Hi folks, Christian Brindle here, Medicare health plan expert and specialist, and today we are back. It's that time of year again where the Medicare commercials are running rampant, and they're trying to get their hands on your Medicare, right? They're trying to get their hands all over your Medicare. They're promising you things that you probably aren't going to be able to qualify for, and they're preying on you, right? The Joe Namath of the world, the Joe Theismann, and now Jimmie J.J. Walker from Good Times is doing everything they can to give you misinformation about your Medicare. I'm going to react to this absolutely horrific commercial and just kind of break it down for you and show you what they're really saying in the fine print. Things that you need to know before you pick up the phone and dial this 1-800 number. So without further ado, let's just jump right into this unbelievably bad cookie cutter commercial. They're all the same. They're not original, right? They're all saying the same crap. So let's just start it off. Jimmie J.J. Walker, paid endorsement, right? Shocker, right? Is it any doubt that he's just reading off a teleprompter? Does he even know where he is or what he's saying at this point? Probably not. Extra benefits require enrollment in a Medicare Advantage plan. Oh, they actually say the word Medicare Advantage plan for once. They actually tell you what they're trying to sell you. And just so you know, it's the same Medicare Advantage plan you can get anywhere from anybody on any street corner. Nothing special. So let's just keep on rolling.
Hi, I'm Jimmie J.J. Walker. If you're on Medicare, listen to this. I called the 1-800 number to see what extra Medicare benefits I could get. An actual person answered, looked up my zip code, and boom.
They looked up your zip code probably for the first time ever. Here's a little nice piece of information when it comes to Medicare Advantage plans. Every single state is going to have different Medicare Advantage plans. And actually, some larger states are going to have multiple different kinds of plans depending on what part of the state you're in. So there's lots of different plans. Lots of different plans. And it varies tremendously from one part of the country to the other. Medicare Advantage plans have a lot of different working parts, right? They have networks you have to worry about, what hospitals you can go to, what doctors you can go to, what plans have you get referrals to see specialists from your primary care doctor. That's a pain in the butt if you don't really know if your plan is going to require that or not. Does your plan give you in and out of network capabilities? How does it cover your prescriptions? Dental, vision, hearing, medical benefits. There's so many different things you need to know. These people that sit in these call centers that run these ads, they are essentially more or less going to be putting in the zip code a lot of times for the first time, looking at the plans for the first time. They don't know your market, and that's freaking scary.
Boom. I was offered extra benefits like dental coverage, including dentures, extractions, fillings, plus prescriptions, transportation, meals, and so much more, all at no additional cost. And then I asked about the benefit that adds money to my Social Security check.
Not available everywhere, for one. And a lot of places where it is available, it's $20 a month back, $30 a month back. It's what's known as a Medicare Part B give back benefit. And it is available in some places, but a lot of markets only offer it in the form of plans that don't come with prescription drug benefits. They're known as Medicare Advantage only plans. And a lot of people I've known that have called one of these places that live in markets that don't have one available unless it's a no drug plan benefit. They'll try to push you into that plan and not even tell you that it doesn't have prescription drug coverage. This is making me sick. It's making me nauseous. Let's keep going.
And get this, I'm entitled to an extra $100 a month. That's
not everywhere. Very few places actually do $100 a month or more. And and not every market's going to have that available. This advertisement's being ran in all 50 states. That's what's horrible about this. This is predatory. This is absolutely disgusting. It's predatory. These people should be ashamed of themselves. Come on now.
$1,200 a year added to my Social Security check. And I was like, dynamite. Call the 1-800 number on the screen and see what you may be entitled to. Call now. It's free.
I called and she looked up.
It's free to have your Medicare destroyed and ruined potentially. Yeah, sounds like a good deal.
My zip code and said I could eliminate copays and get expanded dental work.
False. Medicare Advantage plans come with copays unless you're eligible for your state Medicaid, which at that point you typically have to be in poverty levels of income to get. Show me one Medicare Advantage plan that doesn't have any medical copays. I'm waiting. False advertisement. I really think Medicare needs to step in and do something about these commercials because they're harming people. Just complete false information and downright lies.
Prescriptions, transportation, and meals, all at no additional cost.
I called and couldn't believe that my zip code has dental care, transportation, meals, and the benefit that adds money to my Social Security check every month.
Look, your zip code may entitle you to save money and get significant extra benefits, including expanded coverage for dental work, all at no additional cost. Plus, you may be able to get money added to your Social Security check every single month. Fact is, you don't get these benefits automatically. You must call. Call and get everything you may.
This is what I have such a problem with about these commercials. They make it seem like you have to call them to get them, right? They make it seem like they're the only ones that are going to be able to provide this for you. When in truth, anybody who is AHIP certified and contracted with the various different insurance companies can provide you these plans, and they're going to vary dramatically from state to state. When they say you may be able to get this, it's their way of covering their butts to say that very few areas have all of these benefits that they're talking about. Very few areas, and they know it. But they're just trying to get you to pick up the phone so they can tell you, oh, actually, the benefit you're calling about is not available in your area, but let us sell you something else. It's a classic bait and switch, and it's been going on for the last couple of years, and it's harmed a lot of people.
Be entitled to.
I'm on a fixed income, so I called to get money added to my Social Security check every month.
Call and get what you may be entitled to. Call now. It's free.
Call.
All right, disclaimer, my favorite, right? They go through these so fast, and they do it on purpose so you can't read them. They don't want you to read them. And then they also put them super fine print for a reason. So let's read this disclaimer. The 2021 Medicare Helpline is not affiliated with or acting on behalf of any government agency or program. Shocker. Outside of Medicare annual enrollment period, members can enroll in a plan only if they meet certain criteria, special enrollment periods. A licensed insurance agent can help you determine whether you are eligible. Your call will be directed to a licensed insurance agent or third party or health plan intermediaries holdings, LLC, who can provide more information about your Medicare insurance plan options. There's no obligation to enroll. The information is not a complete description of benefits. Oh, how about that, right? So you're saying that $1,200 a year is not a complete description of benefits? Zero copays, which what they mean by that is you're talking about zero copays for a primary care doctor visit. Not a hospital stay, not an emergency room visit, not an ambulance visit, not a specialist visit. But they're not going to tell you that in a TV commercial. They want it to sound like you're getting full coverage, and they know damn well what they're doing. This is not a complete listing of plans available in your service area. For a complete listing, please contact 1-800-MEDICARE 24 hours a day, 7 days a week, or consult Medicare.gov. So basically right there, it's telling you that they're, covering their butts.
1-800-759-3066. That's 1-800-759-3066 now.
It's absolutely horrible, folks. First it was Joe Namath, then it was Joe Theismann. I mean, it's all these different people, right? You have to see through this stuff. I encourage you to see through this stuff. Make sure that you don't fall prey or victim to these. I've told multiple stories about clients of my own that have been very close to being harmed. There was even someone that lived in my home state with a plan I knew very well. They called one of these places. And essentially what happened was they were trying to get her to go onto a plan that would give her $50 a month back into her Social Security check, right? It's a plan I know very well. Sounds good. It's with the same insurance company she already had. Here's the problem. That plan had no prescription drug coverage, and she took 3 insulins a month. She's a diabetic. And those insulins all together would be about $1,000 a month retail value, and she would have had to pay that. And they told her she'd get 100% coverage on these insulins. called me, told me the name of the plan in question, and I gave her that news, and she was horrified, and she was so glad she didn't change. Make sure that you don't fall for these snakes and these serpents, because that is exactly what they are. My company is actually licensed in 43 states, and we're a real specialist. We are actually there to help you, and we're actually going to look out for your best interest. Not like these absolute predators that you see on TV. Give us a call. Give us a try this open enrollment period. We would love to be able to help you. Our office number is 801-255-5340, 801-255-5340. I hope you saw through some of the faulty advertising. I think anybody that advertises like that clearly doesn't have your best interest in mind. They're trying to trick you. And you know what they say? If there's lies and deceits if there's lies and deceit in the courting process of the relationship, imagine how it will be when you're actually married. Anyway, folks, hope you enjoyed this video. If you did, do me a favor. I need your help with this. Drop a like on this video. It helps more people like you that need help. You need to be saved to find our message and to find it quickly. Drop a like on the button. Please, please, please like this video because it helps with the YouTube algorithm. Drop your comments down below. What do you think? Do you think this should be allowed? Do you think something should be done about it? I'd love to get your thoughts on it. Make sure to hit the subscribe button, hit the notification bell so you're notified when we upload, and we'll make sure that we keep exposing these absolutely misleading and harmful advertisements on a consistent basis. Thanks so much for watching. We'll see you next time, and happy Medicaring.